So welcome back to our YouTube channel where we share and create awareness on conditions that are affecting our people. We urge you to subscribe, to share, and also like. Recently we were discussing about diabetic foot, and we did not finish up. We had defined what diabetic foot is as a complication of uncontrolled diabetes. We talked about the natural progression of the condition and how it ends up, and we mentioned the two theories of peripheral neuropathy and vasculopathies. Then we went further and talked about the management, where we talked of debridement. We mentioned the types of debridement, and we mentioned mechanical debridement, enzymatic debridement, autolytic, biological, but we did not finish on surgical debridement, which is also called as sharp debridement. Now, surgical debridement is one of the common types of debridement, apart from the mechanical, where there is dressing, wet to dry dressing, removal of scab and dead tissue. But in surgical debridement, we use knife or curette, to remove devitalized, damaged, and also infected tissues. So we cut them off, where we usually take patients to theater. So we remove most of the infected or dead tissues until you can see good perfusion on tissues. So the other thing I wanted to add onto this topic is when we are talking of wound care, using the Wagner classification, we talked of type 1, type 2, and even 3 as those that we employ wound care in their management. You see, in diabetic foot, standard care requires that we offload the weight on the diabetic foot ulcer. We also control the infection. We remove the ischemic or devitalized tissues, and of course we have to have glycemic control. So I want to stress on wound care. On wound care, we have other alternatives from what we just said about debridement. Use of honey, the one from bees, natural honey. Now, honey has been used for a very long time, even before antibiotics came into use or before their discovery. Medics used to apply honey on wounds, and they used to heal. You see, honey has got some advantages, whereby it removes the inflammation of the wound, it removes infection. It also has some antioxidant properties. So all those contribute to healing of the wound. Actually, in deep ulcers or wounds where honey is used, it fills up nicely, granulation tissue appears there, and the wound becomes shallow or fills up completely. So we should embrace use of honey in the management of diabetic wounds, especially Wagner 1, Wagner 2, occasionally Wagner 3. Now, Wagner 3, also you can use enzymatic methods of debridement or use of vac dressing. This is vacuum assisted closure of a wound. So here, what is usually done is there is a sponge which is applied to the diabetic ulcer or wound, and then a tube is inserted just above on the sponge, and then the tube and the sponge together with the wound are covered with the airtight translucent or transparent polythene, which is airtight, and then the tube is connected to the portable pump, which is usually connected to electricity or a socket, source of power. So you set the power to around the pressure around that's 75 to 125, so approximately 100 will be fine, millimeters of mercury. So as you put it on, it will suck fluid from the wound, cleaning it up, also reducing inflammation. It will aid in bringing in blood, making the wound moist, pulling the edges of the wound together. And so this method of wound care will reduce even need for large plastic reconstructions, like grafting, because it pulls the edges of the wounds together, therefore reducing the size of the wound. As it sucks, providing negative pressure on the wound, it also brings in blood supply. So this will help in bringing in nutrition and also antibiotics to the area, and therefore helping in healing of the wound. And also it sucks out the fluid together with microbes or bacteria that may be on the wound. So vac dressing is a new method that can aid in reducing number of disabilities and amputations in diabetic foot. The other method that needs to be embraced in managing this diabetic feet is provision of oxygen, hyperbaric oxygen, or TOT, that is topical oxygen therapy. Hyperbaric oxygen is provided to the whole patient, where the patient enters into a controlled chamber or a room where he or she breathes in almost or about 100% oxygen. And the TOT is provision directly of oxygen to the diabetic foot ulcer, where the ulcer is, directly through use of some gadgets. The importance of oxygen is that one, it is needed for energy production at the level of the cells in the affected foot. It is also important for collagen formation, fibroblast formation, for angiogenesis, and for superoxide production. Superoxide is important in wounds because it makes the cells resistant to infection. So provision of oxygen through those two forms will help in reducing cases of amputations and in aiding the healing of diabetic feet, and therefore preventing amputation. So this is a new area that is supposed to be explored, especially in Africa, even in Kenya, because we do not have these facilities in our areas of practice or our hospitals around the country, even in major towns. So we urge our leaders, political leaders, policy formulators, and also implementers, to look into this way of reducing morbidity and mortality in managing diabetic feet. Diabetic feet are difficult to manage once they occur, but provision of oxygen would reduce the rates. Actually, if you provide oxygen, whether hyperbaric 100% or topical oxygen, you improve healing by 50%, 50 to 60%. That is a significant population of the patients who are affected. So as I conclude about diabetic foot, I would say that for standard care, for us, To help our patients, we need to offer them standard care, which includes infection prevention or eradication, management of ischemia or devitalized tissues through debridements, and provision of what I've just said, use of honey, antibiotics, vac dressing, and also provision of oxygen, either through hyperbaric way, that is systemic, or directly topical oxygen. And we will also need to ask our patients to commit to glycemic control, so that as we offer them these other services of trying to improve leg perfusion to prevent amputation, they should also control their sugars through diet and of course through medication. It could be through injection of insulin or use of oral hypoglycemics. So we want to provide that kind of care, which is comprehensive, so that we prevent loss of limbs. So thank you very much. Continue subscribing, liking, and sharing. We'll bring you some more information. So thank you very much.